Hi, this is Dr. Roger Knapp, pediatrician. Colic is a kind of a general description of a child that's crying, usually starts in the infancy or newborns. But there's different kinds of colic. And colic just means the baby's crying, and there can be several different causes of that. When the baby cries, though, they tighten up their abdominal muscles and can express a little bit of gas, but the gas hardly ever causes pain. The baby passes gas 24 hours a day, kind of like Dad. It's caused by the tremendous amount of milk that they drink, breast milk and formula, because when you drink that much lactose, you can't digest that much. Just as if you and I drank 3 cartons of cow's milk a day, we'd have gas. You can't digest that much. But the baby passes gas 24 hours a day. You'll feel the diaper, them toot a little wind in the morning and grin, gas smiles. So the colic generally isn't caused from gas as much as it is the protein in the substance, such as cow's milk, and they're allergic to the protein, or if they just can't digest it. And there's, of course, soy-based formulas and even stronger elementary diets such as Nutramigen. But we can see that in both breast and formula-fed babies. But all babies have colic in the evenings for 2 hours for 2 months. And it's not increased gas, but increased bowel activity. For some reason, in the evenings, they have more active bowels. And with more contractions, they'll express a little more gas, but that's secondary. The problem is just more active bowels in the evenings. And most of the time it's mild, where the child is just restless, uncomfortable, whiny, and you can pacify them with a pacifier. Now when their babies are crying, you can do several things to try and alleviate their discomfort. You can put them in the swings, use a pacifier, and just hold them, rock them. Let me show you with my baby. Looks kind of like me, doesn't it? So let's say this is my baby, and you can, when they're in your arms like this, face up, they tend to cry more. And babies cry less leaning forward, and that's a lot of times you'll see the parent put them up over their shoulder, and they stop crying, not because of your shoulder, because on the forward incline. So the other way to do this, and that's the way I like to burp them, is palm to their chest, put this arm between those 2 fingers, finger thumb into their cheeks, and it's a good way to burp them. But for some reason, when you put them forward like this, they just kind of hang there and cry less. Dads actually like a football hold like this, so if you got their cheek supported this way and their head supported, and you rock them like this, then a lot of times they'll be quiet, and really nice to know in church and restaurants and places. So putting them on a forward incline helps. Actually, grandparents used to carry them over their arm like a sack of potatoes. But we like to have their head in line with their body and not bent forward, because it crimps their airway and lowers their oxygen. And that's why we don't like people who carry their babies in a cloth sling, because their head has been in a C shape, and we actually have some major troubles in those slings. So when you're holding them in your arms, you want the neck on your arms so that the head is in line. Same thing for when they're in seats, in car seats, swings and things like that. We want their head in line, so if their head tends to be bent forward, you can put a blanket, receiving blanket, under their back so that their head falls in line with their body. So it's real important to keep that airway going good. And so that's why we don't like them sleeping in your bed either. Not only do you roll over on them and there's more crib death, but we want them on a flat surface so that they're in the soft bed, they tend to be bent. And so on the flat surface on their back is the best way. But going forward is a real common way to burp them, as well as have them less crying in that position. So that's a nice little trick. But expect it for 2 months in the evenings for 2 hours, usually 6 to midnight. Some babies it's after midnight, but usually in the evenings. If the baby is crying all day and all night, that's generally not colic, but that's something wrong with the baby. We check see if they have an ear infection, or they have a bladder infection, or they're allergic to what they're drinking. and it's not really classic colic. The baby's crying all day long, but generally there's the reason. So have your physician kind of evaluate the baby. And usually we try and talk you out of medications. We don't like a lot of medicines in babies. The Mylicon gas medicine will not help. Even controlled studies, we gave half the parents Mylicon, the other half water, and they both felt it might have helped a little. And so I don't recommend the gas medicines. If the child is screaming bloody murder for 2 hours in the evenings, then we can actually give you some cramp medicine. It's been around for many years, it's safe, and we just use it in the evenings for the colic cramping. But it's a cramp medicine, not a gas medicine. But that's a common expression. Grandmas will say, well, the baby's got gas, translated, he's got cramps. We really don't recommend a lot of medicines though, so most of the time it's not that bad. But if it is quite severe, call your pediatrician. Maybe he can call you out some medicine for that. Just bear with it. This will go away eventually. Thank you.